Armed conflict throws an entire population into a state of crisis, bringing life to a total halt. Aid programs become the only short-term solution to provide relief to the vulnerable. The 1987 LRA insurgency in northern Uganda left the health system in a state of disarray. We spoke to some of the medical doctors and nurses who witnessed the breakdown of the health systems in Gulu, Kitgum and Amuru district during the conflict.
By then also transport was a big problem, and there was this issue of curfew.
The attrition rate was so high, and some few staffs lost their lives.
And all these dead bodies were displayed in Kitgum Government Hospital. On that specific day, we had received newly transferred staffs from the center who had reported to Kitgum Hospital. They also disappeared because that was their first time to see such a bad sight.
The government started rebuilding the health systems after the Lord's Resistance Army got pushed out of the region. But the attrition caused left an ailing health system, which then required special attention during the course of recovery.
Okay, NGOs have drastically reduced, and that means the support that we had during the emergency has drastically dwindled.
Up to now, we are still having only one who only reported received the handover, but because of the poor theater, which was renovated also poorly, he has not yet taken off. We are not enough on the ground, and patients are overwhelming. Activities are many in the health facility.
In the wake of a new dawn after insurgency, people seek assurance of secure livelihoods. The conflict areas face challenges of sustaining the established aid facilities.
The diseases have not gone. The pattern might have changed. Like, gunshot wounds have dried up, malnutrition has gone down, but we've heard of insurgence of malaria.
Seeking health services was also a bit difficult because now they were from distant locations.
Senior nursing officer at the Tiak Health Center 4, Bernadette Lamunu, says the internally displaced camps came in handy at this point.
There, people were in the camp and it was easy to access the services.
The 2007 government initiative, Peace, Recovery and Development Plan, that was established to strengthen health services would then see more health facilities constructed, rehabilitated and equipped in Acholi and Lango sub-regions.
The sub-county has around 4 parishes, only 1 health center. There is nothing like any other place they can go.
However, priority was centered on areas that would bring the highest returns. Back then, the authorities announced that the program would be rolled out across the region. It's almost 10 years since the program was launched. The doctors here say the government's intervention in these health facilities has been insufficient.
Every day admission is 15 to 20. So if a patient is taking like 3 days on the ward, you find the capacity is not enough. Some patients, you find them on the floor now.
The fact that Atiak Health Center 4 is the biggest health facility in Amuru district means that it serves a much bigger population than it was meant to do. The medical doctors here tell us that malaria and communicable diseases make up the biggest percentage of their disease burden. But their only call to government is to help and improve and increase as well health structures here in order to enable them accommodate the bigger numbers.
We would expect government to actually expand their provision, the budgets they give, but also the human resource and how it's allocated there, to give them some affirmative action on this.
According to the 2014 population census, the northern region has over 7 million people. That is an estimated increase of 4 million people in about 2 decades. But how have the strategies changed over the years?
Currently, as we talk, there are people who are getting hard-to-reach allowances.
PRDP 1, then there was PRDP 2. After that, there was also NUSAF, specifically the targeted accommodation of health workers.
It is now a common sight to encounter clusters of families on roads trying to retrace their routes. The question, however, is whether health workers are making the same journey.
Others have come back, others who have found more greener pastures elsewhere have never thought to come back. For example, here we are supposed to be around 49. but apparently we are around 17.
But without also coordination, we find that not the best results. I mean, we are not getting the optimum results that we would get with the resources currently in this area.
During implementation of PRDP activities, priority was given to major causes of mortality and morbidity. Some of these included malaria prevention and control, reproductive health, child health, HIV and AIDS, human resources for health, infrastructure and equipment. But what impact have the formulated initiatives created?
The government also seems to be biased. How do you give the medical doctors 2.5, then the rest below?
Our male involvement is still a bit low. So I need our men to be sensitized on their roles as partners.
As all this happens, many people in the region are still waiting for a way forward.
The community still have that passive way that this is for government. We need to address the community to know that this is theirs.
Walter Mwesije, NTV.